So according to DSM-5, which is a manual, it's like a body that teaches us how to diagnose mental health illnesses, the things we need to look out for. If in the past 2 weeks or longer, you've had 5 of these 9 symptoms, low mood, loss of interest or pleasure, meaning the things that used to excite you and motivate you and make you happy is no longer making you happy. You no longer have the zest for living. You don't wake up and say, oh, today is another day, I'm going to contribute to society. You might wake up feeling, oh God, another day, oh my goodness. Or you can't focus your mind on what you want the mind to focus on. You want to work and your mind is drifting all over the place. Or you don't just have energy and you've gone to tests and they say it's not malaria, it's not typhoid, there's nothing wrong with you, tests are normal. Think about depression. Significant and unintentional weight loss. That means you're not trying to lose weight, you're not on a diet, you're eating okay, or you're not eating at all and you're losing weight. About 5% over 1 month, 5% of your body weight. Or you're gaining weight, it depends on people's personality. Insomnia means you're not sleeping very well or you're sleeping too much. Agitation or retardation, you are slow in your thinking. You used to be able to answer questions like this before, but suddenly you have to think a little bit for things that you know, but it's just not coming to you. So there's a retardation or an agitation. You're exceedingly easily angered, easily irritable. Finally, you feel worthless, you feel guilty, and you think of death a lot. Death is like comforting. You're like, oh, if I could sleep and not wake up again. If you have 5 of these symptoms within 2 weeks, on most days of the week, according to DSM-5, that is depression. So there are different types, different ways it shows up. It could be a single episode. You can have it and it can go. Or it could be recurrent. And we say it's recurrent when within 2 months of having these symptoms, you're free within 2 months and then you have it again. That's recurrent. Or it can be persistent for more than 2 years. I have a couple of patients who have been persistently depressed for years and years, some of them since teenage, and they are adults at this point. There's something called unipolar or bipolar. That means depression can be a part of something else. It could be a part of another disorder called bipolar, or it could be by itself in addition to something else. So the bottom line I want you to take away from this slide is that depression is not the same as sadness. Sadness is a part of life. Ups and downs of life, that's fine. But when you are depressed, it's a mental health illness and you need to get help. But I'm here today to talk about preventing it. This is just like, introduction. So how common is it? Altogether in the whole world, 300 million people are depressed. Sometimes we think we have it worse in Africa. It's not true. I'll show you in a few slides more that actually the rates of depression in America and in Europe is higher than in our country, despite all the difficulties we're going through. That's to tell you that there's more to it than socioeconomic status. There are so many other things that make us at risk of being depressed, apart from living in a difficult country. Because if that's the case, then the American people would not be depressed, right? But they are. They're even more depressed than we are, and the Europeans as well. According to WHO, between 2005 and 2015, there has been an increasing number of people having mental health difficulties all over the world. In Africa, about 30 million, 29.19 million people are depressed all over Africa. In Nigeria, we know how many we are, over 200 million. 7 million of those people, of us, are depressed. The sad thing is that these terrible numbers are not even probably the truth. It's probably way worse than that. Because we know that a lot of people who are depressed don't come to the hospital, don't keep records, don't show up. They think it's spiritual problem, they think it's malaria, they think it's anything else, stress, the world is, country is difficult, they don't even know. So these numbers I'm telling you, especially for our country, it's way worse than that. In addition to that, we can actually have low mood, depression, in addition to medical problems, physical problems. They can go hand in hand. They can even masquerade. A physical problem can masquerade as psychological problem, and a psychological problem can masquerade as depression. People who have HIV are at increased risk of having depression. People that have stroke are more likely to be depressed than those that don't. So I'm just trying to tell you that depression can happen with physical illness. It's not just, oh, it's only a psychological problem. Someone can have psychological problem and a physical problem together. So this is a slide that shows us that compared to other parts of the world, sub-Saharan African countries like us, we're even, towards the lower levels in prevalence compared to other countries like the European countries and Americas. What are the risk factors? What makes one person living in this same difficult country, going through the ups and downs of living in Nigeria, more likely to have depression than another person? Number one, gender. Unfortunately, it's commoner in females than in men. And truly, in clinic, most of my patients are women. It might well be because women are the ones that speak up and cry out and have more contact with the healthcare personnel than men, it might well be. Women come for antenatal, they are screened by their gynecologists, women bring their kids to see the pediatrician, and like that, that might be the reason why they are easily identified compared to men. I don't know, but I suspect so. Family history. If in your family, a mother or a father or a major significant caregiver was depressed, the chances that you yourself or your sibling will be depressed is higher. And this is easy to explain because as a child, you copy your parents' model behavior and you copy what they do, how they react to stress. So if you have a father or a mother who is depressed and can't really be there for you, then inadvertently you have also picked up on these cues and you're more likely to react the same way given the same kind of symptoms. Alcohol use disorder. If you have a parent who is an alcoholic, the chances are higher. If you have a parent who has tried to take their life or has actually succeeded in taking their lives, it's going to be more common in you. But then again, these are risk factors. These are not cast in stone. You can have risk factor and not end up being depressed. These are just telltale signs that you should be more careful than someone who doesn't have these factors. Childhood experiences. Over and over again in clinic, I see people with difficult, terrible childhood experiences. Time would fail me to begin to describe for you what people are going through. Young people have suffered and trying to keep it together. Terrible experiences can predispose one to depression. Loss of parents, abuse, neglect. Then your very personality, just the way you are. There are some people who are neurotic. Neurotic means they are more likely to be pessimistic than optimistic. They are more likely to be able to react in certain ways, in more extreme ways than someone who is not. So that's just the way they are. That's the way they are. So that kind of personality increases your risk of having depression. People who are just naturally insecure, dependent, there's something called dependent personality disorder. People who, because of, family history, parental upbringing, they feel like if they're not supported by other people, they can't stand by themselves. They feel like they need other people to support them and nurture them to be able to make serious decisions. Those kind of personalities are at an increased risk of depression. Recent stressors, illness, financial problems, these are the ones we probably are very familiar with. Oh, his wife died and he became depressed. We are familiar with these, but these are still risk factors. It doesn't mean that everyone who has a recent stressor will have depression. It's a risk factor. Then I highlighted, the highlight you're seeing is the things that we should take note of. Lack of intimate, confiding relationships, so social isolation, loneliness, feeling like you're a burden, especially as we age, the elderly, increases the risk of depression. So you see elderly ones, oh, I don't want to bother you. I'll give you an example off the top of my head. When we had that currency swap, when Naira was difficult to find, I called my parents out of the blues. How are you guys doing? I hope you guys are fine. And my mom was like, oh, we're fine, we're coping well. My parents live in Lagos. They are pensioners. And then I kept pressing because I know my parents. Are you okay? How have you gotten along? How have you guys been managing? My brother, I have an elder brother in Lagos. Did you have cash to spend? That was when my mom told me that for 2 days they had nothing to eat. I blew my top. What do you mean you don't have anything to eat? Why can't you call me? Why can't you call my brother? I have 2 brothers. in Lagos. I don't want to be a bother. I don't want to disturb you. So you can imagine, I had to tell myself, this is your mother, calm down. I was upset. So this idea that I don't want to bother you, I don't want to be a bother, it increases the risk of depression, because then you don't tell people what you're going through and you're alone and you're isolated. Low socioeconomic status, we're familiar with that. Other factors that increase the likelihood of someone being depressed. Hereditary can actually run in families. So if you have twins, identical twins, so if one twin is depressed, over 50% chance that the other one will be depressed as well. That's to tell you is more than, what we tend to think. Oh, get over it. Wow, it's okay. It's okay. No. It's more than that. There are certain chemicals in our brains that have to be in certain balance. When they are imbalanced, people can become depressed. That is why some medications actually help with depression. They help to equate and balance out these chemicals in our brain. Medical conditions, there are some medications that telltale side effects is actually low mood, confusion, and you'll be thinking you don't know what is going on with you. It might just be the medication you're taking. Substance use disorder. So this is like chicken and egg, the substance use. Substance use meaning using stuff like weed, like, all sorts of names. Colorado, loud, crack, to help yourself cope, can also increase the chances of you being depressed. And depression can increase your risk of using substances as well to cope with the stress that you're going through. Then immunologically, that means your immune system is affected when you are depressed as well. No wonder people, telltale signs for those that are doctors in here, when you see someone, today is cold, tomorrow is catarrh, diarrhea, malaria, typhoid, every time malaria, be careful, that person might be going through depression. So this is an overview of the things that increase our risk of depression, the causes. Psychosocially, that is from a therapist's perspective, the way we see ourselves when we are depressed changes tremendously. So you go from seeing yourself as someone who can cope, who can handle things, who is a survivor, who is strong, to someone who is a failure, not good enough, can't measure up. When you begin to see yourself that way and see other people in a negative light and your future, there's no hope, then that is what depression is from a therapist's perspective. Other medical or psychiatric illnesses can also increase the risk of depression. Next slide, please. You guys are behind. Okay. So anxiety, when you are worried, not just worried, when you have an anxiety disorder, when you've seen a doctor and they say, this is generalized anxiety disorder, or this is post-traumatic stress disorder. I'm not talking about anxiety like I'm scared or I'm afraid. No. I'm talking about a diagnosis that a doctor has made. When you have any of those things, the likelihood that you have depression in addition is high. Developmental disability. There are some people who have never been diagnosed, but they do have developmental disabilities like reading difficulties. I have a patient who has a reading difficulty. She's an adult, and she has always thought that she was dumb because at her level in school, from primary school, everyone could read, but she just couldn't put the alphabets together to form a word. It wasn't clicking in her mind. So since then, and she's 36 now, since then she has felt, I am dumb, I am stupid. So those things increase the chances of someone seeing themselves as not good enough, not as good as other people, and leading to depression. Dementia, especially in our elderly ones. When you have been diagnosed as having dementia, telltale signs are easily, can't remember things the way you used to, can't remember what you ate for breakfast, can't remember your child's name, then there's a problem. And if the doctor calls it dementia, there's an increased risk that you might have depression in addition. Eating disorders as well. Now, there are other symptoms and signs that come along with depression. So I want to mention this because when we get to preventing, we're going to look at each of these symptoms and then we're going to look at what to do to prevent it from becoming depression. So these symptoms and signs, I use the word associated with because you might have these things and you don't necessarily meet criteria for depression. But if you don't do anything, you can eventually end up being depressed. So these are the things that come around, they hang around before depression is diagnosed. Extremely negative self-talk. So if you notice that you are your own worst critic, We all have, that part of us that is always running commentary. You make a mistake and your mind will tell you, what kind of stupid thing did you do? How could you be so stupid? You're dumb. Somebody else could have done this better. That's critic in your mind. Rumination means something has happened 10 years ago and you still go over and over and over it. The person has died and you are like, that thing they did to me, I can never forgive. Rumination, self-blame. So something goes wrong, you're in a team, and then you say, but I should have known that this thing would happen, I should have prevented it. I had a patient who had her marriage breakdown, and she said, I shouldn't have stayed there for so long. I should have been able to prevent this and get my kids out of there. Why did I tolerate such a terrible person all these years? Why did I marry him? It's all my fault. And I said, you think so? To you, the marriage failed, it's all your fault? She said, yes, it's my fault. So she forgot that for you to be married and for the marriage to fail, it has to take two. It's impossible for it to be 100% your fault. But there are people that think this way. So self-blame, tendency to blame yourself. Self-criticism. So people like that don't tell themselves, interestingly, people who are self-critics, they don't tell themselves, well done, you did that well. They discount it. It doesn't matter that you did well. Everybody else did well. Oh, you got an A in the test. It was easy. Oh, you were the first to come today. There was no hold up. They will always look for a reason to discount the positives, but the negatives, they would beat themselves up. Global and internal attribution instead of situational and external. That means you tend to blame yourself for things that happen rather than looking at situational problems. For instance, this lecture presentation started late. It's my fault. If I had come 35 minutes on time, I wouldn't have delayed them. Versus my laptop is slow. I should probably get another one. I would now say something like, I must be a dumb person to have not planned ahead and known that my computer would have taken time to come up. I should have come 35 minutes early, stuff like that. So when you attribute things to internal versus external, global meaning consistently, not just that I didn't remember today. I never remember. What a failure. What a not good enough person I am, because you should know you've had this laptop for years. That is global and stable or internal attribution versus situational and external. Helplessness. I have a patient who has a master's degree. She's in her mid-30s, married with 3 kids, and her husband keeps threatening to throw her out. And she says, I don't know what to do. And from my perspective, as a therapist, so I'm like, what could you do? Have you worked before? What qualifications do you have? But if you're not a therapist, you'll be like, come on, girl, you have a master's degree, you went to university, you are educated, you are computer literate. What do you mean you don't know what to do? But that is how people think. There's something called learned helplessness. When helplessness has been modeled to you, you may know someone, you can see the solution before them, and they're like, I don't know what to do. I don't know. They really don't know. They're not even kidding. Because helplessness is an attitude, it's like a mindset that you can actually learn. Reduce physical activity. So remember, these don't necessarily have to go with depression, but when you have the more of these symptoms I'm mentioning you have, the more you need to be careful. Then going forward in the next slides, I'll be explaining what to do about each of these symptoms I've mentioned. Low mood. So I said that low mood is not equal to depression. But when you are persistently upset, persistently sad, you ruminate, you self-blame, you're a self-critic, you talk negatively to yourself, you are well on your way to being depressed. Social withdrawal. When you don't like people to know what you're going through because they will judge you, they will take advantage of you, they will talk about you, and you don't have a close friend, you don't have a confidant, then you're well on your way. It's a risk factor, it's a sign. So we're going to talk about what to do, like the antidotes to these signs, so that we can prevent it from coming together and becoming depression. Hopelessness. Hopelessness is especially important because the more hopeless you are, the higher the chances of self-harm. I've gone beyond depression even. Depression, yes, self-harm. So regularly, consistently, whenever I see people as a therapist, I always assess level of hopelessness. I assess sadness, I assess anxiety, because these are the things that come together and can increase the risk of suicide. And we know that as a country, we are up there in terms of the rate of suicide, unfortunately. So finally, how to prevent depression. So I'm going to name the problem on your right, and then on the left is the solution. What you can do to nip these things in the bud so that they don't accumulate and lead to something that becomes more difficult to solve. So for extremely negative self-talk, if you catch yourself, persistently talking down on yourself, persistently beating yourself up, then the solution to that is check the facts and respond realistically. For instance, it's my fault that this presentation started late. I should have known. I'm such a clumsy person. I'm such a failure. I'm not good enough. Other people would have known to come on time. Negative self-talk. Solution. What are the facts? What is the evidence that I'm stupid? Is my stupidity and my foolishness and my not being good enough that made this thing to be slow? Is it not more like my computer was late or my computer was slow? And perhaps the surface of this podium wasn't, projecting versus my fault, me. So checking the fact means asking yourself, what is the evidence that this thing I'm telling myself is even true? Really. And not just believing what you tell yourself. Because just because you tell yourself something does not mean it's a fact. It's an idea. It's a belief. And the mind will produce ideas and thoughts, just like the ears will hear. You cannot break your ears and say, why did you hear that? Thus the way you will not blame yourself for some thoughts. But you can decide on what to focus your mind on. When your ear hears stuff, you can decide, I'm not going to listen to that. I'm going to focus on this presentation because I want to get something from it. The same way, when your mind produces some negativity and tells you some things that are hurtful, you can check it out. You don't need to swallow it hook, line, and sinker. You can check it out, and if it's not true, then ignore and focus your mind on what is realistic. Rumination. So you did poorly. Maybe you didn't act in the best way possible. You didn't do the best. Maybe as a parent, you shouldn't have scolded that child like that. And then you go and think about it and you keep bringing it up and blaming yourself. What kind of mother am I? What kind of father am I? Who does that? And now this child is like this because of me. The antidote to that is acknowledge what you did right. So you actually raised the child. You put a roof over his or her head. You did your best financially to put this child through school. This child had his or her own decisions depending on the age. So what did you do right? And then you made mistakes. Oh yes, you did, because nobody's perfect. And there's nobody in the whole world that will say, I've never made a mistake in my life. Rather, we are a balance of weaknesses and strengths. So you can actually learn from your mistakes so that you are better next time. So rather than kicking yourself and beating yourself and going over and over it, you can pick the positives, learn from the negatives, and move on. Self-criticism and blaming yourself. You can forgive yourself. So this is easier to say than done. A lot of people are struggling with self-dislike. A patient of mine said, hate is a strong word, but I don't like myself. I said, I understand. With self-dislike, and you feel like you're to blame for a lot of things that are going on in your life. It's painful when you see yourself in a mess. In addition to that, you feel like you even contributed to the mess. So in other words, your suffering is deserved. So some people don't even see me because they feel like, well, I'm getting what I deserved. Why will I want to get treatment for? What about the people that I did that to? They don't have treatment. I need to be punished for what I've done. And they don't come for therapy. So rather than doing that, you can give yourself a break for not being a machine and being perfect, for being fallible, for being a human being. You can give yourself a break and practice gratitude. So gratitude means focusing on the positives that you have in your life or in yourself and thinking about it. Yesterday, I attended a live webinar in the evening. I was late because of I had a program earlier, and they were talking about renowned psychologists from Germany was talking about something called savoring. So savoring means to immerse yourself and fully participate in a good moment, in good mood. That when things are going well, you pick out the things that are going well and you fully focus your mind on that thing that is going well. You know how we tend to fully focus our minds on the things that are going bad? They tend to get worse. So if you do the opposite and you say, oh, I am in good health. Oh, I'm actually I'm sound. I don't have any of these mental health disorders. At least the doctor said so. And then you're like, oh, thank God, there's so many people. You know what I mean? Focus your mind on the good, on the good things you have going for you. What will happen is that it increases your level of appreciation for life and reduces your chances of having depression. Then keep a list or a daily journal. So I said this to a patient and she was like, these things I'm writing down, everybody has them. Why should I write them down again? And I had to explain that sometimes when we are depressed or going through difficult times, all our mind can see is the negative. It's like glasses that you wear. When your glasses is dark, the whole environment, regardless of what it really is, regardless of the reality, to you it is dark. If I come in here with my dark shades, your light can be as bright as you want it to be, but to me it is dark. So practicing gratitude means taking off that glasses for a little bit and focusing on brightness a little bit and the things that are positive and not taking them for granted. We have a tendency to take the good for granted and then we focus our minds on the bad. And it's one of the telltale signs or the risk factors for depression. Global and stable attribution. So you see the example I gave. Rather than blaming yourself, not even only yourself, but consistent, stable characters of yourself, why don't you consider that there might be things externally that can be responsible for that same outcome? It doesn't necessarily mean that you are a failure because you failed that test. Some people think if I don't get 100%, then I've failed. And it makes so much sense to them. Of course I've failed. Is it 100? No, it's not 100, so it's a failure. But then I tell them, but is it possible that there are different shades, that is not just black and white, that there is a gray as well, and that you could have gotten 80-something? Does that make you a failure? Interestingly, in therapy, when I use examples of people that others care about, when I put their situation on someone they love, if it's a woman, I put on their children. If it's a single person, I put on their best friend. If it's someone I put on someone they love. Suddenly they say, of course it's not, it doesn't mean you're a failure. So I say, if your child, for a mother, if your child failed an exam, does that make the child a failure? Say, of course not. Of course not. It just means they have to work hard on that subject. I said, yes. It's so easy to see something when it's on someone you love because we tend to have more compassion on others than on ourselves. But when it's for you, it's almost like the standard is different. You have a higher standard for yourself. Your standard is rigid. But for other people, yeah, of course, it's okay. But for you, why should I have done that? I should have known. So I'm talking about how to prevent depression now. Problem, social withdrawal. There is a part of an emotion that urges us to do something. In the presentation I'll give next year, thank you to the DIFF management, I'll be talking about how to handle intense, painful emotion. And I'll be talking about emotions. But I'm just going to mention this now. Emotions have an aspect of them. If you were to dissect an emotion, there's a part of them, anatomically, like a part of an emotion, that wants to move you to do something. So when you're angry, you're moved to react. When you're sad, you want to withdraw. So when we feel these emotions and it moves us to do something, we don't need to do that. You don't need to withdraw because you feel sad. You can actually act in opposition to what that emotion is pushing you to do. For instance, so I'm sad and I feel like I'm a failure. People will judge me, people will manipulate me, people will hurt me. So I don't come for presentation. I can't stand here. You'll be like, what kind of boring, dry, what is she talking about? I will decline engagements. I will decline coming to talk. I might not even show up for clinic. I'll just be in my house and, ruminate on how terrible what happened. I can act in opposition. I can decide to go out even though I feel like staying at home. I can decide to wear lovely bright clothes even though I feel, down. And doing this will improve my mood. So it's something called behavioral activation. So behaviorally, you do things in opposition to how you really feel, rather than following the emotion to act in the way it is pushing you. Hopelessness. So for people who feel like they are hopeless or the situation is hopeless, one thing that always works is to remember what really matters. what is this? What are you all about? What matters to you? So a lot of people will say God, family, children, health, leisure, pleasure. And then I begin to ask them, what have you done? What can you do every day that would help you to, move towards these things that matter to you? An interesting example is a long time ago, I had a patient that had sickle cell disease. So he had a lot of crisis. He was in the hospital, but he wouldn't take his medication. So we kept saying, take your medications. The hematologist kept bringing it. At the end of the day, she got tired and said, go and see Dr. Anireto. So when I saw him, and I said, why won't you take your medications? And he said, I'm so busy. I have to provide for my family. So he had this idea that to be worthwhile, I have to provide. A lot of men have that, and there's nothing wrong with that. Then I said, what matters to you in this world? Tell me the number one most important thing. He said, my wife. I said, oh, wow. He said, then my kids. I said, what else? Money. I said, okay. And we had a list. So then we drew a circle that represented 24 hours of his day. I said, how much of this 24 hours goes to the wife that you love so much? And to his own shock, he was surprised. It was not even up 5%. And I'm like, so what do you think about that? You love this woman so much. She's the most important thing in your life. But your life is all about other things. Things are happening. So that was when he realized that he had to adjust. So going back to that medication, I said, you need to stick around for this woman. And one way to be sure you're sticking around, be alive, is to take these medications. So that was how we got him to take the medication, because he saw it in a different light. Before, he was thinking, the medications are going to slow me down. I don't have time. I have to make money. I have to take care of my family. But when he realized that what really mattered was this woman and his kids, and that he wasn't even, interestingly, using his time to pursue what mattered, then things changed a little bit. Helplessness and procrastination. So I told you about helplessness earlier. Another telltale sign that can be associated with depression is procrastination. I'll do this some other time. I know I have to submit this project. I'll do it tomorrow. I saw a patient earlier in the week. You know how expensive master's programs can be. She paid for a master's program. And as I saw her, she had an assignment due. And she had not even opened the assignment, as expensive as it was. Procrastination. And she kept procrastinating until the last moment. So the thing with procrastination is, underneath it is this idea that this is too hard. I can't deal with this right now. I'll deal with this later. So one way to handle this is to break it up into smaller bits so that you don't have to deal with this big thing. You can just do one thing. And it can even go as far as something simple like getting up in bed. If you've ever been depressed, you will know how hard it is to get yourself moving. Before I became a therapist, I was in another hospital. I didn't know as much as I know now. I wasn't a therapist to start with. I was a family physician, and I saw a patient. That was part of the reason I became a therapist in the first place. I saw a patient and I knew she was depressed because I'm a doctor. And then I told her, do exercise, go out for jogging. She didn't come to see me again. So looking back on it now, I know that I didn't understand that she had postponed seeing me over and over again because she couldn't even get out of bed. Which one is exercise? I can't get out of bed. You're talking about exercise, really. So procrastination, to handle that, break everything down into tiny bits. So getting out of bed, break it down into sit up first. You've tried. When you sit up, then stand up and go and use the bathroom. Well done. Then you've gotten up, right? Then you have to make your bed. So everything, break it up into tiny bits. It reduces, it brings it down so that it's not this big thing that I have to do. It's do just this one thing and then give yourself credit. So as a solution, you can see, give yourself credit. So just the way you blame yourself for things going wrong, when things go right, be sure to tell yourself, well done, you go girl, I did that well. Because it's one of the ways to silence the inner critic. Remember, the negative self-talk is one of those signs associated with depression. So to counter that is to give yourself credit, to praise yourself for doing things well and praise others too, if you can. Reduce physical activity. So if you move around daily, some people may know that I don't use the lift. I've had someone ask me, are you afraid of heights? I said, no, I'm not afraid of heights. I just want to use every opportunity to move. So physical activity actually, I mentioned chemicals when I was talking about causes. It actually increases some of those chemicals that are imbalanced in depression. And it's your way of fighting back, of countering some of these telltale signs I've mentioned. Beyond depression, physical activity is great. Reduces cardiovascular risk, reduces the risk of so many medical things, high blood pressure, blood sugar, things like that. So low mood, if you feel sad and it's not depression, you can actually look at your schedule and schedule something that you know will make you happy or give you a sense of achievement. So if you've been putting off reading that book, read one chapter and you can tell yourself, I did well. And then that can make you increase your mood. There are other things you can do to counter low mood, a whole list of them. So reward scheduling, you can actually schedule, the way you schedule appointments and you schedule things to be done, you can actually schedule good stuff in your schedule as well. Scheduling is not only for things that have to be done or things you are supposed to do. It can also be for things you enjoy doing and things you like to do. Schedule time with your best friend, schedule time with your wife and your children. I have a patient who is struggling with an addiction, gambling. And interestingly, when we talked about the addiction link chain, one of the things that helped us to break that chain was to act according to what he valued, and that was family. So one of the things we did as action plan means like a homework, the things you do to help you get along in therapy, to make you work on your difficulties between therapy sessions, was to schedule time to spend with his family and with his children. So this was someone that came from, so he's a man, this is someone that came from the point of view that my wife won't understand what I'm going through. My wife does not have the intellectual capacity to handle what I'm going through. So all the financial problems, he took care of it. He didn't want to bother her. So part of our action plan was talk to her about it. Let us check, let's test, let it be like an experiment. Let's see whether she really has the capacity or not. And lo and behold, part of the reason why he felt this way was because he was 10 years older than the woman. So he felt, she's young, she won't understand. Lo and behold, this woman exceeded expectation. In fact, the woman blew him away. She was on top of things and she gave suggestions that he didn't even think of, and he's the breadwinner. So things like that. So when you schedule it in your timetable, the way you schedule work that has to be done and things that you deadlines to meet, schedule things that make you happy, schedule things that give you pleasure, hanging out with the girls, going to see that movies, playing with my kids is in your schedule. In that way, you ensure that at least during the week, there's something to look forward to. There's something that makes you happy. So self-soothing is learning to comfort yourself. Too many of us are depending on our husband, our wife, our children to make us happy. A lot of women are seeing me because, not only because, but amongst other things, because of marital dysfunction, difficulty, stress. This man, every time this man, this woman. But they forget that they have potential in themselves to make themselves happy. And you know what happens? When you make yourself happy, you become attractive all of a sudden. The man that didn't have time for you suddenly is like, you're looking good today. You're like, thank you. And you're off on your way doing your thing. Suddenly, the woman that didn't have your time will be like, are you going out again? Oh yeah, I have an appointment with my girls. But you don't stay around. Okay, you know what? When I come back, we hang out, okay? Suddenly, the man or the woman is not the center of your world again. And then you become attractive to them, and then you become irresistible. So you're indirectly doing what you have wanted to do and you've been fighting to do directly since. Stay at home, stay with me, stay with the kids. And the man's like, I'm busy, I have to work. Self-soothe. Do your own. So self-soothing, to break it down, means using your 5 senses to give yourself a sense of relaxation. So what you see. There are some people that are looking at the picture of their kids or their best friend or some, artwork makes them happy, gives them a sense of relaxation, or looking at the beach, or looking at some pictures, or, something that you see. When you look at those things, it gives you a sense of relaxation. Look at it. So use your eyes, your senses, the things you hear. There are some sounds that are soothing. There's some people that when you call them, they always know what to say to make you happy. They always know how to console you. Do that. Then what you're eating, I'm not saying you should be dependent on food or anything. I'm just saying that as part of your toolkit to helping yourself feel better, if you know that you like tasty food, take yourself out. Buy yourself, peppered snails or whatever, and then just eat it. I was on a call with my mom the other day, and she was like, oh, the roads are bad, there's no lights, the country is difficult. I'm like, mommy, it's true, the country is difficult. You know what? Go and buy yourself chicken. Like, yeah, buy yourself chicken and eat it. If you like, don't give daddy safe. Just eat it. And she did. And I called her later. I said, how are you feeling? I'm just cool. I'm okay. The country is the country, but we're going to do what we have to do. Things like that. So I'm talking about self-soothing. What you see, what you hear, what you can taste, what you can smell. No wonder, there's some scents that relax. There's some things that you smell and they either remind you of something that has happened that makes you happy, or they put you in the space that makes you relaxed and calm. No wonder some people stay in the bathtub, they tone down the lights, they listen to soothing music, so what you can hear, they put scented candles. All these things are ways to self-soothe and make yourself happy. So I'm talking about self-soothing, using your senses. So all these senses, be creative. You know yourself better than anyone else. What are the things you would hear, see, touch, taste, smell that would make you happy? Do it, or schedule to do it. Social support. So increase your social network. If you're not the outgoing type and you're like reserved, at least you have some people close to you, or develop those relationships. Self-expression. Some people are festering and suffering because they don't know how to put their feelings into words. So if you can't say it, write it. I have patients who would rather write stuff down than say it. And then when they write stuff down, I can read it and I'm like, oh, I get it, I understand. So look for a way to express yourself. If talking is not your thing, write it down. I have patients that say it with lyrics. Have you ever heard of something like that? You have lyrics of a song and a song can say it better than you. Send the person that lyric and say, this is how I feel. They will understand. Self-validation. To validate yourself means to tell yourself that how you're feeling makes sense given what is going on. And tell yourself that. You don't need to wait for someone to tell you, it's okay, I understand. You can tell yourself, things are okay, it will be okay. It's understandable I feel like this. It's understandable I've not overcome that, I've not let go of that heartbreak and it's been 2 years. It's okay. I'm someone who deeply connects. I'm someone who loves deeply. It's okay that he has moved on and I'm still here. It's fine. I'm going to take my time. There's no deadline on recovering from heartbreak. There's nothing like, oh, time is up. You mean you've not recovered? Oh, that's terrible. No. It's take your time. The deeper you connect, the harder it is to let go. So give yourself a break and let yourself mourn. Let yourself recover. So self-validate. Spirituality. Very important. I'm glad I'm talking to people of faith. So for those who serve God, there's a major advantage that we have. Why? Because if you believe that you dwell in the secret place of the Most High and you are under the shadow of the Almighty, then you will know that these external things, they will come, they will go, and it's working for your good. You will know that even though it hurts now, even that hurt, God doesn't allow you to go through pain just like that. We don't serve that kind of God. We serve a God who uses everything, including our pain, to help us, to mold us into His image and to make us better people. So when you remember things like that, some people have scriptures written where they can see them. You go to some houses and you see scriptures on frames. It's not just decoration. They see it in the morning and their spirits are lifted. Some people have it at their screensavers. Some people have it on their, desktop. Because listening or hearing these things makes you realize what is important and makes you shift your focus from the gloom and the doom to give you hope and motivation and counter depression. Problem solving. So this is actually a skill. Some people are just born being able to know how to solve problem and break it down. Some people don't really have that. Either they've not really had it modeled to them or they just don't have that skill. But you can actually learn to break down problems. Sometimes in clinic, all we do is problem solve. I'm terrified that my husband is going to kick me out any moment. I don't know what to do. And then we sit down, we say, what's the problem? What are the options? What can we do? What's the advantage of doing like this? What's the disadvantage? Which of the options has the most advantages and disadvantages? What are we going to do? Okay, try this one out. If it doesn't meet expectation, we'll try the next one. So learning those skills and doing like that can actually be what you need to prevent you from feeling so disorganized and, pulled from both sides. So I've been talking about people who have one or two signs or that are associated with depression and how to, nip that in the bud and prevent that from accumulating to depression. Now I'm talking about people who have nothing. You know, people who are, you don't have anything, you're not ruminating, you don't have, you're not withdrawing, you don't feel burdensome, you're okay. There's actually something you can do to maintain that okayness and make sure you keep being okay. So that's what this slide is all about. Things you can do to remain okay and make sure you don't, begin to fall into that category we talked about earlier. So accumulate positive emotions. So this goes back to looking at what is important to you and putting that in your schedule every day. The things that matter to you, the passion, the things you're passionate about. And that goes beyond your job. So your job is, you're an office assistant, but you're passionate about music. You can sing, you love to play the keyboard or whatever. So do something in line with that thing that matters to you, regardless of what it is that is your occupation. Then not only that you're doing it, you're planning for it. Like, make future plans. So the doing it is like the short term. But long term, what could you do to actually actualize this your passion, this your dream? Do you need to get additional qualification? Do you need to get some certificate courses? Do you need to put yourself out there, go online and look? Doing these things will keep you in that place of being positive and being more realistic. Build a sense of mastery. So whatever gives you a sense of accomplishment or whatever makes you feel like you've achieved something, do a little bit of this or work towards building your capacity to do that going forward. Cope ahead. Sometimes nothing is wrong now, but in the future you can tell, this mother-in-law of mine, we're going to have a wedding in Australia and oh my goodness, she's a handful. You can actually begin to prepare ahead how to handle what's the worst that would happen. Imagine the worst and then prepare what might you say, what might you do, how might you prevent this from getting out of control, and visualize yourself. So this is very helpful in people writing exams. You have a major exam and you are worried that you're going to fail, and failure is catastrophic. It means a lot. Then we can begin to imagine the worst case scenario. God forbid you fail. What could you do? You need to read. How could you read now? Do you have a schedule? You do a schedule. Okay, what if you get there and you forget? How can you remember the things you're reading? Do you have mnemonics? Do you have a way of revising? Do you have a reading partner? So you can plan ahead, and then you imagine yourself in that exam hall. Imagine yourself going and you are writing and you're remembering. So doing this is almost like rehearsing ahead of time for what has not happened. What happens is that when that exam finally comes, you feel like you've written it 1,000 times in your mind, and you're like, let's just go and do what we've known to do. Let's go and do this. So that is what you can do. If it's ahead, the thing that you're worried about is in the future, you can actually plan ahead for it. You can think about the worst case scenario and solve it before it even comes. Then treat physical illness. I was telling you that physical illness can go hand in hand with depression. So you can begin to take care of your body so that your emotions remain okay. If you're physically ill, you're not going to have the best emotion. And you're even vulnerable to having, being upset and being sad and being easily angered. So treat yourself, like see your doctor and take those precautions and do the periodic health checks. I'm glad this is this forum because I know that's what we're all doing here. So well done. And then exercise. Take care of your body. Do physical exercise. Some people will say, but I don't want to lose weight. There are some things you could do. You will not lose weight. You will build stamina, 30 minutes, 3 to 4 times a week. You're fine. You won't lose weight. You'll be just the way you are. And if you want to lose weight, then you up it to 1 hour. And you don't have to do it at a stretch. You can break it up. 30 minutes one time, 30 minutes another time. Doing this in itself will prevent depression because of the hormones that are released from physical activity. And avoid substances. Don't be tempted to take a sleeping pill because you are having a bad night, or to take alcohol to kind of help you cope, or to smoke something because I need to feel better. If you do that, you're actually complicating the issue because you are keeping yourself open to addiction. And sleep, very important. If we don't sleep very well, the chances of our having poor mood will be high. You are not at your best when you don't sleep well. You are irritable, you are easily angered. What you could handle before, you can't handle it again if you had a bad night of sleep. So sleep, let there be a habit. So sleep hygiene means the different steps you take to make sure that every day you are getting okay sleep, refreshing sleep. So have a particular time you go to bed, have a particular time you wake up, regardless of how you slept the night before. So if I slept badly last night and my wake up time is 6 a.m., Wake up by 6 a.m. Why? Because the chances of your sleeping well this night will be more because you are awake early. If you stay in bed till 10 a.m. because you must get that sleep, chances are that by that time of night when you're supposed to be sleeping, you are awake because you spent all day in bed. So have a time to sleep, have a time to wake up. Have a routine you do just before you sleep. So some people go for a walk, talk to their mom or their husbands, read their Bible, say their prayers, and then they sleep. So have some things you do in the same order every night. You talk to your mom, you read your Bible, you go to sleep. You have your bath, you read your Bible, you go to sleep. So doing those things tells your brain that, oh, we need to start winding down. And it increases the chances that you have a good night's sleep versus if you just, there's no order. Then eat a balanced diet means vegetables, fruits, dairy, complex carbohydrates, water intake. Because if you keep your body healthy, your mood will be better for it. Final words. So if you've tried everything I've said, and you know you've been struggling, and you're suspicious that there might be something going on with you, you don't need to keep struggling. There's actually medications. There are actually people whose job it is to help you. Please seek help and don't struggle by yourself. So in conclusion, depression is very, very common, not just here in Nigeria, all over the world. It reduces the quality of life. It may even lead to suicide or self-harm. So having risk factors, like I mentioned, does not mean that you are predestined to have depression. It just means that you're more likely than someone who doesn't have those risk factors. Bottom line, it can definitely be prevented. There's something you can do to help yourself. Thank you.
Thank you, Dr. Chika Anireto, for this very in-depth presentation and teaching. We want to take questions, so please, the mic is going around, so she can answer some questions if there are. I have one question. You said for the ladies, for the women, wearing their makeups can improve their state. What do the men do when they are feeling depressed? Because you only directed it to ladies. Yes. Do you want to do? Should I give you something?
Well, while the secretary is getting paper for you to ask, to get your questions, to jot down your questions, I will just add 2 questions and then pass my comments. Thank you, Dr. Anireto. You're always a delight to listen to, and I am too shocked that Anireto finished her discussion in 50 minutes. This is the first time. It used to be 1 hour, 10 minutes, 1 hour, 20 minutes. This is amazing. Now I know she can. Well done.
Put in special effort.
2 questions first before my comments. Do children have depression? Children. And how does it manifest? Okay. Now, this is a spiritual gathering. And see, it's good we know that no one is immune from this thing. And the Bible said of Jesus, and the Bible says, and the Holy Ghost strengthened him. See, there was a day Elijah, I'm not talking about Elisha, I'm talking about the real Elijah. He was so depressed, and he told himself that, I'm not even worthy to be alive. Lord, just kill me. Don't, so that it would be, I would have killed myself, but kill me. In other words, From the Old Testament, we see a man of God of immeasurable strength and power that had depression. So nobody is mute. I'll give you an example. Yesterday, I'll tell you your scriptures. Yesterday, I knew I was to assist the doctor to do surgery by 4 p.m. I knew. So mentally I was set. Then by 4:15 p.m., the head of finance walked to me and said, "Sir, we've just bought 6 million naira worth of diesel." I was so tired in my inner man. I was so tired by that information, because on Thursday we bought 2 million. On Wednesday we bought 2 million. On Tuesday we bought... I was tired. But I told myself, don't tell yourself you are tired. Because if you say it, the devil will hold it. So I just walked straight to my wife. I said, you know what? Let's go home. Because when I get home, gist will start. Let's go home. She said she wants to say, pack your load. Let's be going home. No wonder the Bible says in Ecclesiastes chapter 4 verse 10, woe to them who are alone. So immediately I just told my wife, I said, why are you going to go? Let's go home. Then I mentioned the issue of diesel, and she dropped the word of faith. Remember, God said He will help you. So you must have somebody, I agree with you, young lady, that you must have somebody to talk, somebody that can stir up faith, because faith is the victory. I like the medications, what they can do. I like the psychotherapy. But when it's all over, you will understand that what the devil is after your faith. But once he can take your faith, the next thing is that you even want to die the way Elijah did. Now, as part of your teaching, one of the things that cause depression, is low socioeconomic status, a sense of hopelessness and helplessness. The reason is because the economy is slow. Things are bad. And sometimes the things you fear most comes upon you. The Bible says in Job chapter 3 verse 12, Job, the man of God, became so overwhelmed to the extent that his wife even suggested he should curse God and die. Why? Depression. Because the things he feared most has come upon him. The antidote to fear is faith. That is why the Bible says in Mark chapter 4 verse 24, be careful what you hear. Luke chapter 8 verse 18 says, be careful how you even hear it. Dr. Anireto, so now you hope you're writing all these scriptures down so that you'll be adding it to your notes. And when you finish saying it, make reference to me, that I'm the one that gave you the... So, what I'm saying is that the social media is now the engine house of projected depression. Now, I was in America. I'm just about to leave. My daughter was looking at Instagram. At a stage, she said, you know what? I'm going to take myself out of Instagram. That everything I see here is projected comparison and depression. Do you know that from artificial intelligence, a girl who is on Keke Napep will take a photograph that will suggest that she's in first class of Emirates. And then you begin to see yourself, my God, see my classmate, the first class Emirates, she's on Keke Napep, the back seat. The Bible says in 2 Corinthians chapter 10 verse 12, young girl Anireto, write it down. It says, he said, they that we dare not make ourselves of the number or compare ourselves with some that commend themselves, but they measuring themselves by themselves and comparing themselves amongst themselves are going to have depression. You're going to have depression. Because how do you explain that your classmate is earning $5,000 in America? You were better than him or her. Here you are in Nigeria earning 200,000 naira. When you convert it to dollars, you are earning $200. Will that not make you, everybody must know he's God for himself. Thank you for telling us that we should love our neighbor as ourselves. So we know, have compassion on yourself. Some people don't even love themselves. So if you want to know a man, for those of you who have not married, if you want to know a man who will love you, check out how he loves himself. Check out what he says about himself. Check out the value he places on himself. Let me tell you, nobody is immune from depression. If you doubt it, ask the 12 spies that went to spy out the promised land. You think they don't have sense? It is what they saw that made them pass those derogatory comment about themselves, to the extent that full-blown firstborn of Israel said to themselves, we are grasshoppers. When a man look at himself, or a woman sees himself and say, you know what, I'm a grasshopper. All grasshoppers are meant to be killed. So it means you are already getting to a state of imminent collapse. And finally, distinguished brethren, each of us must have a word from God in times like this. Because when the chips are down, it is what God said that is going to hold you. I'm telling you, not what the social media says, because the social media is inundated by lies. It is nothing but the toolbox that the devil is using to project lies and lead men and women to depression. Depression has come to stay. The Bible says it is a fool that uttereth his conversation. If I'm to paraphrase that, I'll say it's the fool that says everything he has in his mind in the social media. So, if that is the case, Apostle Paul writing to the church at Philippi, in Philippians 4:8, said, finally. So it is also my final. Brethren, whatsoever things are true about yourself and about what God has said, whatsoever things are honest, the way you give expression and validate yourself, whatsoever things are just, and whatsoever things are of good report,